We know that despite all of the money and attention that has been given towards hyperacute and acute care, the best opportunity for functional outcomes in our stroke patients can be realized through stroke rehabilitation. And part of that is meeting the needs where they need to be met. And for most everyday experiences, people want to be in their home. They want the service tailored to their individual needs, and they want to be met in an area that they're comfortable, which is usually their home environment.
We use the transdisciplinary model of care, which means we sort of blend roles where it's appropriate to blend the roles. So perhaps an occupational therapist may do something that would traditionally be thought of as something a speech therapist would do. So we do that within what's appropriate, and each discipline still brings their expertise to the table.
My role with the team is a registered nurse. I go into the clients' homes in the community and I educate the clients and their family members on stroke, and I also do some secondary prevention on stroke to help minimize their risk for recurrence of stroke. So that may include teaching them how to manage their blood pressure, diet control, losing weight, if they have some problems with blood clots or atrial fibrillation, how to manage their medications properly.
As a clinician who has worked in a clinic that has everything at my disposal, I have every kind of assessment or tool I might need. It's been a little bit of adapting to working in someone's home, but it's been an easy move into that area because there's so much more to work with inside their home. In your clinic, you're always working on your client generalizing their skills from what you're doing in your clinic into, hopefully they can generalize that into their home setting. But with the early supported discharge team and working within their home, you've sort of taken out that step and you're able to work right in their environment where they need to use the skill most.
My name is RENEE SANTHA. I am a therapy assistant, and I follow through with the treatment plans that therapists have provided for me. We could be going outside, going for a walk, doing strengthening and that sort of thing, and then come back home and do speech therapy, or even along with our walk we could be having conversation and doing speech therapy.
I'm a speech pathologist or a speech therapist with the early supported discharge team. So my job is to work with stroke patients that have communication or swallowing problems due to their stroke. So it might be somebody that has trouble understanding what other people say to them. It might be people who have a hard time getting their words out because they can't find the right words, or they have a problem with their speech function, so their speech is quite slurred. So for those people, I'll provide them with some therapy and some strategies to help them communicate. I also work with people who have problems swallowing due to their stroke. So for those people, that involves giving them some exercises to help improve their swallowing, as well as monitoring what they're eating, helping them to make good choices about foods and liquids that are easier for them to swallow.
I'm a recreation therapist on the team, and we work towards the global goal of getting you involved in your community and recreation activities, and that encompasses working on all the skills that you're working in all your other therapies. So you take the skills you're learning in OT and PT and speech, and we apply them to everyday life out in the community, in a skill that you, or an activity that you enjoy doing. So something that actually improves your quality of life.
We're always trying to improve the way we do things. Part of that improvement is now taking it beyond just the medical treatment of patients following stroke, and it's about bridging into community and realizing the potential that patients have for recovery following stroke by using a rehabilitation service like early supported discharge.
About 1:15 in the morning, I thought, gosh, time for me to go to the bathroom, and then I thought, no, I'm just going to lay here for a few minutes, and then I thought, no, I better go now. So I tried to get out of bed, and I could not move my right side at all. I've tried to really hard, and just absolutely wasn't moving, and my arms or my arm or my leg. So then I woke up my husband and I said, you know, there's something happening. I said, I think I'm having a stroke. Well, got up right away and got dressed, and he phoned 911, and the ambulance was here in a matter of minutes. But I couldn't walk at all. Like this whole right side, all the way from my forehead down, my leg, arm, was completely useless. It was paralyzed.
My right arms and legs were paralyzed through the stroke, and not only the mechanical problem, from the first days after the stroke, I had trouble with English, and it wasn't just, you know, how do you pronounce the words. There's a certain cognitive problems that I simply didn't understand at all, and that's one of the biggest things with a stroke is you don't know what works, you know, and what doesn't work.
I found my speech was slurred. I had temporary paralysis in my right side, my right leg, right hand. One of the things I found, it was very difficult for me to shave. I couldn't coordinate my hand. It was very difficult to write. I was writing in little pinpricks and dots. So that was quite a shock to the system, and it's changed my life.
First off, I have to say that the ESD program has been very helpful to us. We have enjoyed the ESD program because after you've been in the hospital for 8 weeks, that's a long time, and you get to a point where it's difficult to spend long periods of time in the hospital.